Connected by purpose, driven by passion. This is Children's Healthcare Canada's Spark Live webinar series.
Children's Healthcare Canada would like to thank our Keystone funding partners for their ongoing contributions that support all of our programs and activities, including this Spark Live weekly webinar series. Spark Live is where we gather each week to curate, convene, and showcase excellence and innovation from across the child and youth healthcare community. Our goal is to spark conversation, ideas, and action. There are two options to join in on the live conversation. Questions and comments for our panel or presenters can be typed into the question box, or comments that you want to share with the audience can be typed into the chat box and be visible to all of the attendees. For those of you on Twitter, tag @ChildHealthCan on any webinar-related tweets or use the hashtag SparkLive. And to keep up to date on all of Children's Healthcare Canada's webinars and other activities, be sure to sign up for our weekly Spark Bulletin by visiting our website at childhealthcan.ca.
Hello, everyone, and welcome to another edition of Children's Healthcare Canada's Spark Live webinar series. I'm Paula Robeson, your host for the next hour. We're delighted to welcome another Children's Healthcare Canada member through the CHEO for trauma and for medically complex families, understanding the environment and collaborating on solutions. As mentioned in the intro, please type your questions into the question box at any time. I'll prompt you via the chat as well, and I will pose the questions to our panelists at the end of the session. Now I'd like to introduce our moderator, who will then introduce her colleagues on the panel. Julie Drury is a mom, advocate for patient, family, and caregiver engagement and partnership across the Canadian healthcare system, and the inaugural strategic lead for patient partnership for the Canadian Foundation for Healthcare Improvement, an organization dedicated to healthcare innovation and improvement. It's my pleasure to pass the mic to Julie.
Thanks so much, Paula. And if we could get our slides up on the screen, that would be great. We've got some great images there of our panelists. So the first panelist I'd like to introduce is from the Children's Hospital of Eastern Ontario, now known as CHEO. Dr. Natalie Major is the medical director for the Champlain Complex Care Medical Program at CHEO, and she's an assistant professor with the University of Ottawa. Dr. Major works on national and provincial initiatives advising on integrated care models, and her research interests are in innovations in care delivery for children with medical complexity. Working closely with these families and their children, she's a witness to many of the challenges such as repeated trauma that parents and children experience. And she strives to provide care delivery that is evidence-based, contributing to improved health outcomes for children living with chronic conditions and meeting the care needs of this population. And that is accomplished in a very caring and collaborative manner. So welcome, Dr. Major, and thanks so much for taking the time. Isabel Jordan is a parent to two teenagers, Zach and Evie, 19 and 16. Her family has spent the past 18 years navigating the healthcare system, and most of it in search of a diagnosis for Zach. His life has been a revolving door of specialist, painful diagnostic procedures, misdiagnoses, surgeries, and all with a background of chronic pain and increasing disability. The ripples of trauma have affected the entire family, and they continue to this day. Both teens and Isabel are using their lived experience and actively working with researchers to make the healthcare system better for patients and families. Welcome, Isabel. Thanks so much for joining us. Jamie Ebert is a stay-at-home mom for two beautiful children, Jacob and Olivia. And prior to having children, Jamie was a project coordinator at Canadian Blood Services. Now her career is focused on managing a complicated parenting schedule. 13 months after Jacob was born, Olivia and her twin brother Liam were born extremely prematurely at 23 weeks. 3 weeks after the twins were born, Liam passed away from a series of complications related to his prematurity. And since then, Olivia has endured a turbulent and challenging 3.5 years, including 9.5 months in hospital, with Jamie passionately advocating and caring for her every step of the way. Jamie spends most of her time driving all over town, trying to manage everyday life as a parent, in addition to a litany of medical appointments and treatments for Olivia. And Tim Eberts, Jamie's partner, is the Director of Property Acquisitions at Canopy Growth. He manages the leasing and property acquisitions for asset management and expansion department. He's a busy guy. His job is there primarily, he loves his job primarily because of the people and the excitement of working in a completely new industry. He's a proud family man who spends all of his non-working time with his wife and kids. And Tim believes strongly in the self-care of parents being the key to survival when managing and caring for medically complex children. With his wife Jamie so effectively managing Olivia's care, Tim's care mostly about providing reliability, support, and a calming presence for his family. He and Jamie are adamant that they must make time to focus on each other, and that good communication, openness, and understanding are essential to maintaining a healthy marriage during challenging times. And so again, thank you for joining us all today. And I just want to take a brief moment to acknowledge that I'm here joining you all from Ottawa, Ontario, the unceded traditional territory of the Algonquin Anishinaabe people. And it is a beautiful day here, although chilly and fall weather. Natalie and Jamie and Tim are also joining from Ottawa, and Isabel is joining us from British Columbia. So let's get into what we're going to be talking with you about today. And we are focused very much in this conversation on emotional trauma. As a panel, what we wanted to bring forward to you all are our lived experiences as parents of medically complex and fragile children who have multiple experiences across the healthcare system in acute care, chronic care, and in intensive care. And so we have all experienced these three areas of trauma: acute trauma being a single stressful, dangerous, or life-threatening event; chronic trauma, which is repeated exposure to highly stressful events; and complex trauma, which defines many of us in the fact that we have had years of repeated emotional trauma in watching our children go through repeated traumatic, both acute and chronic events. And so this is the definition that we've been working with as a panel, and again, focusing on the emotional trauma, but wanting to bring forward as well our perspectives, as well as Dr. Major's, of what might be some of the solutions to support parents in the healthcare system who are repeatedly exposed to trauma, and what a trauma-informed care approach might look like for healthcare organizations. So next slide, Isabel. There is a phenomenon that is starting to be diagnosed in the medical and psychological and psychiatric literature, and this is medical post-traumatic stress. So in mental health disciplines, psychological responses to trauma are categorized by post-traumatic stress symptoms, and you see a list there. And you'll hear through the dialogue of our panel how many of us as parents have experienced these symptoms. The medical trauma, the specificity to medical trauma is the environment where there's been emotional reactions similar to PTSD in response to injury, chronic illness, medical complexity in the treatment of patients and their families. And so this is a phenomenon that parallels what commonly would be called PTSD. Many of us as parents refer to our experiences as medical PTSD. And so the focus of our panel today, again, is on our lived experience of emotional trauma as parents of medically fragile children, and on solutions to build a trauma-informed care approach, referring to how medical teams and health organizations can help to prevent or minimize emotional trauma, and therefore the devastating effects that that trauma has on us as individuals and on our families. And so let's get right into our panel conversation. We're going to chat together for about the next half hour, and then we are very much looking forward to any questions, comments, or reflections that you have as an audience, and we'll spend about 15 or 20 minutes with you to talk about those questions and reflections that you may have. So I'm going to start off with asking Isabel to lead us off. And Isabel, what I'd love to have you share with us is your reflections as a parent as to what does a traumatic response look like in your experience. How have you experienced trauma, and what does that look like? What are the emotions, and how do they occur? How do they manifest themselves? And how might this be different from a typical family going through the healthcare system?
Julie, that is such a big and complicated question, and could be an hour conversation in and of itself, but I won't do that to everybody. So I'm going to keep it brief and say that it isn't what people think it is the short answer. And that it looks so different in different people and to different people and at different times. And I think it's important to recognize that a trauma response in the moment can look like anger. It can look like, I think people think it looks like breaking down or like crying or like shutting down. But for me, it can look like hyper-vigilance. It can look like being super organized. It can look like being really, really put together in the moment, because that's how I dissociate from dealing with the trauma in the moment. Later on, when I'm by myself, when I'm not having to perform in front of my kids or in front of healthcare professionals, that's when I break down. That's when things really fall apart for me. But I guess what I'm saying is that it can be really difficult to know, for a healthcare professional, to know that I'm having a trauma response unless they really know me, unless we have a relationship, unless they make that space to ask, to understand that this is the kind of experience that could be eliciting a trauma response, unless we're the kind of family that has gone through the kinds of things that could make me more prone to having that kind of response. I didn't know for a really long time that I was experiencing post-traumatic stress. I didn't know that it was something that could happen to me, because I didn't think that it was, I thought that it was something that happened to people, first responders, people that were in war zones, that type of thing. I didn't know that having all of these incidents where my son was in danger, or where he was experiencing painful procedures, or where we were experiencing doubt, or where I didn't know what was happening with his healthcare, where these were all cumulative effects that were building up in me. And it was only really very much later that I realized that it was creating mental health symptoms in me. So I didn't know I was having a trauma response. Certainly the healthcare providers around me didn't know I was having a trauma response. And I think having had an opportunity for conversation earlier could have made a very big difference for me.
Isabel, can you elaborate on some of those symptoms? You've mentioned a couple of them, and Jamie and Tim, I'll invite you to add in here as well. What are some of those actual physical symptoms or emotional symptoms? You mentioned anger and hypervigilance, really common, but any physical manifestations for trauma for you?
So for me, a lot of it came when I actually realized that what I was happening wasn't quote unquote normal or typical, was things like, driving by myself in the car and just breaking down crying and not understanding why. And, kind of only investigating afterwards or thinking about it afterwards. It was really those moments of being alone where I couldn't kind of keep busy and keep organized and keep kind of functioning for other people, that I realized that I wasn't, I was using that busyness and that being organized and that coping and that kind of day-to-day crisis management, that I couldn't push it all away. And then I break down, I'd cry, I'd have flashbacks of traumatic incidents in hospital coming back to me. I know we'll talk about it a little bit later, but I'm realizing more now that I had a lot of avoidance of doing certain things, and we can get into that later as well. I'd love to hear from Jamie and Tim about this as well.
Yeah, Isabel, and thank you for sharing all that. And we've said to the panel, this is such valuable insight information, this lived experience that our parents are sharing today, and I hope it's really being appreciated by the audience. So thank you for sharing all that. So personal, so intense. Jamie and Tim, as you're listening to Isabel, I'm sure a lot of what she's sharing is resonating with both of you. And I'm curious, again, from your experiences, that response to trauma, and maybe you could illustrate that with sharing a bit of a scenario of what you've gone through with Olivia. Like, what did it look like? What did it feel like? Were there physical symptoms? Were there emotional symptoms? Were you, angry, sad? Was it anxiety? What did it look like for you?
I find that for me, when I'm triggered, it flares all my emotions, and I feel and I know that I'm very hyper, and it consumes all of me. And it's like my brain is in a circus. So all these things, it triggers all my memories, all my emotions, and I have a hard time controlling them. So I start talking and I'm all over the place, and I become hyper, where it's not good for Olivia either, because then I'm not a calm presence in front of her when she's the one who is going through everything. And I know that I need to either go for a walk, or I need to talk to someone who is calm, like my husband or a social worker that knows me and can help me kind of talk through it and say, what do you need? And what is it that you're looking for? Tell me what you want. And then I can try to summarize what I'm feeling and say it out loud. I find that to be very helpful. But there are all sorts of scenarios, because Olivia is, time and time again, there's always some sort of test or a poke, or, when she had a GJ, dressing changes, and it's traumatizing for her. And even though it might seem like a small thing for, a nurse who does it every day, all day, it's a big deal for that individual person who doesn't look forward to it and whose skin is literally just raw from the tape because she has bad dermatitis. And so it is a big deal for us. And if I have, someone who's used to their routine and says, well, I've never seen a dressing like that before, so you have to do it, it's kind of putting me down. But I had spent, months going in and out of the hospital with people trying to go, how can we do this better for Olivia, and come up with a plan. And then I'm kind of told that it doesn't look right and put down, and it's triggering. And then it makes me, when I'm trying to do it for Olivia, I don't feel calm.
Yeah, a lot of things there resonate with me as well. It could be the smallest procedure, but because there's been so many and a long history of repeated trauma, even the smallest thing like an irritation from a tape or one extra poke can really put, parents sort of like over the edge, so to speak. Tim, from a dad's perspective, a guy's perspective, sitting on a panel here with all these ladies, is it different for the dads? Is it different for the men? How are you experiencing trauma, and what triggers you in those experiences with Olivia?
I don't know that it's necessarily different male versus female. It's just the role within the household. I mean, Amy's been there every step of the way for Olivia and has been her advocate and her primary caregiver. So I have a role that I have to respond to when Jamie's not to say I don't have my own triggers with trauma, but if I see Jamie being triggered, I then have to respond in a different way and take on new roles in the house, support her however she's needed. I mean, for me, my response is I go quiet, she gets loud. I go quiet, I pace, I think, I go inside my head, and so I have a totally different reaction, and she knows that as well. She can see it in a nanosecond, and she responds based on that as well.
One of the things that we talked about as we were preparing this panel, and we've had a couple of chats in advance, is one of the things that can calm the environment is true respect and partnership with the parents in their role in working together as a team. And I'm wondering, Dr. Major, as you're hearing these comments from the parents about, how they feel about traumatic experiences, what a traumatic experience looks like for them, and some of the emotions that are coming and signals that come along with it. In your role, how do you support that? Do you see the signs and symptoms? Are you trained to see those? And if you do see them, how do you adjust your language or your practice to create that partnership and that respectful role with the families?
Oh yeah, those are very great question, Julie and everyone. And I really am thankful to be participating with you who are experiencing these unfortunate circumstances. As a healthcare organization, if I may say, because I am only in one part of that large organization, I have to admit that I don't believe that we are well trained into the recognition of what our families, children, anyone who interacts with the environment of healthcare, that they may experience trauma. I think there are some specific circumstances that you, and over the years, you become aware. There's a, right now we're all experiencing the COVID situation, the pandemic, the isolation, but there could be a house fire. There could be circumstances that there's some child abuse and so on. But to be part of that interaction in a healthcare environment where we may contribute by how we speak, how we interact, that is something that I really appreciate the opportunity, because we need to develop awareness that this is happening. And by creating a larger scale awareness, there is an opportunity to create changes and to develop a different way on how to interact with our families. So one of the piece for me is I have worked with children with medical complexity, which is a unique group, since 2010. And this has become to our team a very much knowledge, recognition that this was something we did witness. All of what you're expressing, the hyper-vigilance, the anxiety, at times it's difficult conversation, anger. We've all become aware that this is happening. And as a result, within our group, we have explored ways to maybe intervene differently. So as a simple way, but very important, I think, is acknowledging that we need to be compassionate and aware that this is happening, and create an environment that is very safe in being able to talk. So we have to learn to be listener. And when I say listener, I don't mean just the words. I think we need to look at the body language. We need to look at the signs and symptoms that we're seeing in our parents as well. So that's one piece that I think is very important, is the awareness, the recognition this is happening, and having that compassion and the ability to create safety. One more thing I do wish to add, and please, is this is not limited to just the healthcare provider and the physician. I really, really want to stress the fact this is at a whole organization, and Julie and I have spoken about this, but it needs to include everyone: the cleaning people, the clerks, the administrator, our managers, anyone who interacts or is in a decision working in a healthcare environment needs to be involved in that awareness and acknowledging this is an issue. So those are them.
Yeah, that's such a great point, right? This is a team environment. As you were saying with me on a call yesterday, even the person who might open the door for you, or the volunteer sitting at the volunteer desk, or a person you might interact with in the hallway as you're trying to wayfind yourself through the hospital. All those interactions for parents who have such complex care in the healthcare system and long-term interaction with the healthcare system, all those interactions are so important. You know, one of the themes I want to pick up on, and Isabel, I'm going to go into you now, is this space of partnering in care and respect for the role of a parent, especially a medically complex parent. Parents we have such knowledge about our children, and we want to do the right thing and make sure the right thing is done. And oftentimes we go through repeated traumatic events in a similar fashion, where we know something could be done better, but because of a new team member that we might be working with, or someone doesn't know us as well, or perhaps there's a lack of that respect and partnering, it doesn't go the way that we hope it would, or that we advocate that it should go, and how that affects us as parents. And it goes back to Dr. Major's comments on this creation of safe space and active listening and compassion, which are so key to partnering. Do you want to share some reflections about what that looks like for you, that real partnering care approach, and how it can help to support traumatic events?
So did you want me to speak to that or Jamie to speak to that?
Well, I'm gonna, maybe we'll start with you and then, well, maybe we'll start with Jamie, yeah, and then go to you. Is that okay? Thanks as well.
Problem. You know, like I was mentioning with just the dressing change and not being dramatic for her, sometimes what happens is that it's almost like what Dr. Major said, not everyone has the training and not everyone likes being told how to do their job, which can be taken that way by mistake. I mean, Olivia has had multiple blood work. She's had blood work done many times and she's a hard poke, and we know that. And it took someone who finally figured out where is the best place for a poke for Olivia. But even though every time a new person comes in and we say this is the best way to do it, we still get a lot of pushback. And that can be very challenging and triggering, because then the odd time if I say, okay, you've proved to me, and then it doesn't work, and then by the fourth try, we have to go back to the area that, you know, I originally suggested, it's very traumatizing for her and for me. And then it makes it difficult for me then to come home and make my life for my child, the healthy one, normal. And I find that, you know, before we were part of complex care, which everyone loves Dr. Major. She is the exact model of what we need. You know, if everyone could be like her, it would make things a lot easier. There was a lot of chasing specialists and trying to figure out what was wrong with Olivia and repeating your story. And sometimes it's not about not being believed, but kind of people being passive aggressive, I guess, because she's not a baby that cries out loud. And she was so weak and tired that she didn't show a lot of signs and symptoms verbally or physically, like body language wise, but I knew as a parent. And that it actually put her at risk, because there was misdiagnosis. She was given prescriptions that caused a lot of harm to her, like her phosphate levels were in half, so her bones started to fracture, and she had severe rickets, and that went undiagnosed for a very long time without any pain control. And as a parent, it's very difficult now that if the smallest test result comes back, I'm anxious to know the result and I want it resolved immediately, because that was very traumatizing for all of us. And including some of the people that worked with Olivia that actually went, I'm so sorry, you know, I didn't pick up on that. And it's easy not to believe the parent when you don't see yourself some of the signs, but I know her best. And that can be very traumatizing if you don't feel like you're heard.
So that's really a really key point too. And this maybe where I'll bring you, Isabel, in to sort of, you know, comment or follow up. And Jamie and Tim, you know, also please feel free to comment. It's that piece that parents who have complex experience with the healthcare system and chronic experience with the healthcare system have a lot of knowledge, not only about the system and treatment and interventions, but very clearly, as you just said, Jamie, about our own children. We know what works, we know what doesn't work. I know what pain looks like for Kate, and I know what pain doesn't look like for Kate. And you're also commenting on that need for trust, not only for you to be able to trust the healthcare provider, the nurse, the physician, the therapist, but also for them to trust you. And I guess maybe a couple of reflections from the three of you. You know, in your experiences, how do you help the team recognize your knowledge? And how do you help that team establish trust? Isabel, maybe I'll bring you in here for a moment.
This is really hard. So for our son, because he didn't have a diagnosis and because he didn't fit the narrow criteria, we didn't have a team. We had a lot of different specialists. I think a lot of kids fall under that. They don't fit narrow criteria, or they don't have a complex care program. They're complex, but they're not in a complex care program. They have a lot of specialists, but they don't have a team or a medical home. So for us, we didn't necessarily have, for a long time, this really great little bubble of trust around us. But we did have a lot of specialists that we went to. And it became really difficult. Every time we saw a new specialist, it was this very fraught experience of how do we approach this person so that we could convince them that we had knowledge and we could partner with them. You know, do we show up hat in hand, very humble? Do we dress well but not too well? Do we speak medical lingo a little bit but not too much? You're really in such a position of lack of power. I mean, if I were to show up like my real full self, which is I read papers, I have a lot of knowledge, I know what I know, I'm there to learn and I'm there to partner, that's very intimidating to a lot of people. The doctors I really want to work with, that's exactly what they want to hear. And then we'll have a great little conversation and we'll figure out how to move forward. But a lot of people don't want that. And then if it's the only specialist really that you can go to, then the relationship is poisoned. It makes it really difficult to, and if there's like a misstep in the beginning, so that we weren't believed, so then we had to kind of reassess how to approach it, or so that, you know, we had a lot of things happen where we had to do a lot of convincing of we knew what we were doing, or things went wrong. There's a lot of self-blame when things went wrong because I felt like I should have approached things differently when really it was just us not being believed. That contributes to trauma. I know I'm not giving an answer of how to do it right because I still don't know how to do it right. You know, I also have a rare disease and I'm also seeing new specialists all the time. And every time, like I've got stuff going on right now that I need to go to a specialist for, and I'm avoiding going because I'm so filled with trauma response and avoidance because I don't know how to do this. But it shouldn't be on me to do this right. Like, it shouldn't be on us to do this right. It should be the system that understands us better. Am I making any sense?
Yeah,
Absolutely. Go ahead, Tim.
Well, I'd like to add to that, Isabel, because we totally agree with you. It shouldn't be up to the parent. It should be up to the system. But, and we're going to talk about this later about, you know, how you deal with that. But for us, we found allies. We were very intent on finding allies. And it was at various stages of Olivia's care, but people like Dr. Bajur and Dr. Thibault and Dr. Erica Bariziak, these were people that we knew that we liked and we trusted, and they understood us and they knew us. And we would bring them in as allies. And I remember sitting in a meeting once where Dr. Bariziak made it very clear to the group, these parents know their daughter very well, they're very involved, and you need to listen to them. And hearing that message from her was profound. I mean, and you don't always get that.
No.
And let's go there, because that's actually the kind of our next topic or our next theme, Tim. And I would love for you to expand on that healthcare hesitancy that parents might have, and the value of continuity of care, and why strong, sustained healthcare relationships are so important, and finding your allies. Let's expand on that a little bit more, and Jamie, bring you in as well into some of those relationships and how they've formed, how difficult they are to actually find, first of all. And what are some of the characteristics when you find those allies? What do they look like, those people? If I was a parent just coming new to the system, what am I looking for? And I'm looking for an ally, and when I'm trying to create continuity of care.
Yeah, I mean, I think you touched on it earlier when you referred to active listening. I mean, that's a huge part of it. And I mean, it is challenging because the rotations that happen every 2 weeks, and sometimes you find somebody you really love and you may see them in a month, or maybe it may be several months. And so it is challenging because every healthcare practitioner, regardless of, you know, what their title is, has a different style and different opinions on things. And quite frankly, they sometimes contradict each other, and they contradict each other in maybe, like, some of them will literally say, I can't believe that person suggested that for you and put you down that path, which is extremely unsettling. And so, yeah, we find that, and that brings up the complex care, which it was a program that we're a part of now. That provided the continuity that we truly needed. All of the things that trigger trauma for us now happened before we got in the complex care program. And, that was really when, we knew Dr. Major before that, but that was really when our relationship with Dr. Major expanded. And we felt like we had specific people that we could rely on for information. And we weren't having different doctors every 2 weeks, different nurses every 2 weeks. We had, all of our specialists in one place, with Dr. Major kind of managing the overall file, I guess, and that had a profound and positive impact.
There was
on Olivia's
somewhere
care.
to go.
Yeah.
Yeah.
If something was
and Tim, staying with you here, one of the things that can occur in those ally relationships too, or even the ones where, you're dealing with a new healthcare practitioner, is that some of the risk around making assumptions about families' abilities to make decisions, the responsibilities that are being placed on them, often positioned as shared decision making, which we've had some conversations about. What does that really mean? What does that really look like? And some of the heavy responsibilities shouldered by us as parents of medically complex children, those tough decisions we're making every day. And sometimes we don't make them well. Can you reflect on that a little bit? I'm getting into this space now of some of the trauma responses that come out as guilt and fear and shame and really feeling accountable. Can you talk about that a little bit in the context of both those allied relationships, but also working with new doctors and the responsibility that they place on you as a dad and making decisions?
Yeah, it's kind of a two-pronged, in terms of the shared relationship, it's kind of two-pronged. Let's be honest, doctors and nurses are human beings, and they're not all people are the same in terms of their skills, their abilities, their strengths and their weaknesses. And so communication is a big part of that. Some doctors and nurses, their communication is just incredible. And then, there's the full spectrum of communication. So if the onus is being put on the parent to make certain decisions, the communication has to be perfect. And then just like that, not all parents are the same. And it's no criticism on a certain group of parent, but I have a wife who's a very strong advocate, and she thinks critically and she questions, and she always wants to get to the root of the problem and find the answers, and probably drives people at the hospital crazy, but it's amazing for Olivia. And the reality of it is that not all parents have that ability to, whether it's their own communication skills, their ability to articulate, and their willingness to push forward and drive and engage with the practitioners. So for us, that's.
And like Dr. Major said, you mentioned Dr. Major, the training isn't there. So if it's a nurse or a doctor or a teen, the training is not there. And that is so important because, again, this isn't one thing. This is like the 211th thing in my 1 week stay after pokes and tests and, dressing changes and temperatures and anything, oh, I don't like her temperature, we're going to do it in her butt again. No, look at her file. She has a low temp. That's her. It might be small, but it's very triggering because I have no control. I am in a hospital where other people are more in control of my child than I am. So I can't properly parent her, but I know her best and I want to be the parent. And that becomes very difficult when you don't have control.
Mm-hmm. Yeah, Dr. Major, I'd love to bring you in here because this is getting into, what do healthcare providers and physicians need to know about these families? And Tim touched on too, like different skill sets and abilities and communication styles of families. We've got some really articulate parents on here who obviously well educated and knowledgeable, but we also have families who don't have the same skills. And so, how do they become supported? What do hospitals need to have in place or be considering to be able to better support these families?
Okay, so I'm in a tough position here.
You are. Yeah, you're answering on behalf of all doctors.
So I can only speak of the experience that I've been having with my colleague here. So one of the things that I really appreciate is, I've been highlighted as a physician working with some of you. But one thing I want to highlight is I'm working with a large team of individuals. We have nurse coordinator, who are the sort of pivoting point for our families that are just amazing and providing a very, very safe and compassionate approach, as well as we have within our team over the years with lots of advocacy developed and implemented support through social worker as well. And in addition, our organization and in lead Chantal Kranz has put together a program which Julie, you have been part of launching, is the Navigator program. And the concepts of all these interventions is developing that support system for our families. So one of the great support that I think, because we're not going to get all the answers within the hospital environment, and to create change is going to take a lot of time. But one of the things is that there is a parent support group through the Navigator program, which I think has had impact on some of the families, and helping them in supporting them with the conversations, questions, lost of how do I approach certain situations. So one of the challenge with that has been the ability to bring the parents on board. But I think when the connection does happen, it makes a difference. I also know that with our community organization, and this has gone also, I think, in Ontario, there's a healthcare team in the community that also help families and children to navigate that care delivery and care support within the school, the home, because that whole navigation and risk for trauma does not happen just in the hospital and the interaction with the healthcare system. This also happens in the community at home with services that you may receive and so on. So we're looking at I think a larger scale of interaction for this particular group of children and your families, which then may have repercussions to all of our families and children as well. So support, I think, is very, very important. And there's different ways of approaching it. Our team here has over the years navigated this slightly differently. And I'm sure if we were to look across Canada in other centers, there's a lot of other support that are existing, but that to me is another key. To come back to the point of education and training, we practice care delivery and in pediatric. I think we have achieved this much better over the year. We talk about family-centered care. And I think there are some values and element of practice within family-centered care that are very, very similar to the trauma-informed care. And I hope over time that we can achieve and come to a place where we can train everybody in the healthcare system with that concept of trauma-informed care, as we are doing better now, I think, training people with that concept of family-centered care.
Yeah, family-centered care is a really interesting term. I like to talk about family-partnered care, and I think we sometimes forget that trauma-informed care approach when we're talking about partnership and care. I'm going to move us into our questions now, and I want to touch upon this first one, and maybe Isabel, I'll ask you to take this one on. So this is from Susan. She works in a community with families of complex children. They do a lot of transitions with children to home, and praise is often given to organized and vigilant parents who are at bedside and fully engaged. Did any of you experience or see any negative judgment of your abilities as a parent? Maybe you weren't super organized or super vigilant, or maybe you were feeling a bit disengaged. And some of those comments, we have not a super diverse panel here, but from a race, language, culture, income, age point of view, are parents viewed as less than capable?
So I have an interesting take on that. I felt like throughout my son's healthcare journey so far, I felt like I had to present super organized, prepared for everything, bedside at every appointment. It doesn't mean it necessarily was. Like I feel like I'm falling apart, not organized. Like I don't feel like I've got it all together ever. I feel like it's on the verge of collapse all the time, but I have to present this, like, have to have it all together so that I'm taken seriously. It's very much a mask that I put on. And interestingly, maybe 2 or 3 years ago, I found out that his pediatrician was providing resources to other parents, or more resources to other parents who he felt needed help to kind of keep things together. But he felt like I had it going on. In the meantime, I've got like PTSD, like I'm falling apart. I'm like, my physical health is suffering because I had put on this mask. I think there's a lot of assumptions made at bedside and at appointments about parents in general, whether they've got it together or they don't have it together, or whether they're doing enough or not doing enough. And I think the most important thing is that these assumptions just have to go away about whatever you think you're seeing, because whatever you think you're seeing is probably wrong. The only way to know is to ask people and to create a space for conversation. It's the only way.
Yeah, that really resonates with me. Is about, I think sometimes that when you're the parent showing up with your organized binder and you're at bedside and you're asking the right questions and using the right terminology, you're seen as fully coping and fully capable of, participating and taking responsibility. Yeah. And that might not be the case.
Yeah.
Another question that's come up in our question and answer, and Jamie or Tim, maybe I'll ask one of you to answer this one. And this is about asking for second opinions or pushing back. So you're not agreeing with the physician or the nurse, or you're asking for a different opinion. Medicine's a small community. There are repercussions for families when they push against a physician's determination or decision. And bias can end up hurting the child and the family indirectly. So this person is asking, Garrity is asking, how do you navigate these situations? And have you had this experience yourselves? And what did that look like for you? And again, only share what you're comfortable sharing.
Well, for us, complex care has made it a lot easier because now I go through them. And it could be simply like Olivia was due to have surgery and it just kept being postponed and we didn't know why. So I would direct it to them and they'd be the one chasing and trying to figure out what was going on. It made it a lot easier for us. But before we were part of that, that would have been us in challenging things. And it was very difficult because I found that I was on the phone constantly. And instead of caring for my child or being a parent, I was constantly chasing down just even Olivia's occupational therapist to say that specialist is wrong. This test they want to do doesn't make sense. And they're going, yeah, you're right. So, again, I wasn't believed and I had to get someone else to prove that. And it's very frustrating. By then I said, she's going to have another episode where she stops breathing at home, another apnea spell, and we're not going to have any tests done because I'm so busy trying to chase down the right people and the right test and cancel that. And then it takes so much time for them to get back to you. I once said, so in the meantime, like, while you guys are back and forth, if she dies, will they notify you? I mean, I don't know how else to prove that she stops breathing at home and we have to call 911 and we know that something is blocking her airway and we can't fix this. And it's very challenging and dramatic. I mean, my son would witness this. And as a family, we would sit there going, we can't lose another child. And it went back to us just trying to chase down, the right people and people not believing or wrong tests being recommended for her, which don't work for her.
Comes down to the allies again.
Yeah.
Building the great.
Yeah, I know. Thanks for sharing all that. And just to stay with you guys, one of the questions that's come up here in the question and answer box from Kate is a good way to approach your spouse who you really see is responding in a challenging way to traumatic events. And, mood is changing, patience is changing, interaction with the whole family is changing. This wife really thinks it's from a result of medical trauma, and she's trying to figure out how to broach it with her husband. You two having a couple on here is perfect. How do you address that as a couple?
I mean, we're completely open with each other. Neither one of us is shy about expressing our feelings to each other and letting each other know where we are. And it goes back to what I said earlier about just understanding each other. We cope and we are triggered in completely different ways from each other. Couldn't be more polar opposites. So really just having that. I mean, I know when Jamie's triggered, the best thing to do is to grab the kids, get in the van, and leave her to do what she wants to do.
I don't want to talk. I shut down at first. When he goes, how'd it go? I won't respond. I say, I can't talk about it right now. And sometimes it takes me a long time. I don't want to talk to family. I shut my phone off. No, he get a hold of me. He's opposite. And being aware of those emotions. But as for it's different for everyone. I mean, the person that asked the question, social workers were the best thing for us because I felt different chatting with them, being a mediator versus like you care about your spouse and there's a part of you that's going, you weren't there and it's hard for you to understand and I have so much to tell you, where a social worker has been very helpful for us and to help me also communicate even with my husband, who I am open with, because sometimes I'm just all over the place and it calms me down so I can go, okay, I'll tell you what happened today.
Just as a sounding board, yeah, to take the initial rush of the outpouring of information. And then she can speak calmly and yeah, I'd emphasize that for sure. Once we had a social worker that we felt was regularly on our file, that had a huge change for us.
That's great to know, because that's one of the questions as well in the chat box is who is the most beneficial or who is the team member that you've benefited the most from with the complex care team. And it's also a question here from Dr. Deepak Louie on our chat box asking about whether or not routine psychology or psychiatry visits would be helpful after these traumatic events. And Dr. Major, maybe I can bring you in here to describe a little bit with the CHIO complex care program, what are some of the services that are available to families? And then how do you identify those to families or identify the families and parents that might need them?
Well, I can tell you that took years to put this in place, because when we started as a team, it was a physician and a nurse. There are limited resources in our system. And whenever you look at an organization, and this is as I'm getting to understand the system, is they need to look on how to problem solve those needs. So with advocacy and through other complex care program evolving, we had the ability to bring on board a social worker and a system also to be working with the navigator, the community, to have a system in place to have more than one resources, but that's integrated into our community here. And again, that is through the navigator program. And there's different level of intervention. But the role of the social worker and that team getting to know and learn about our families from complex care developed a very unique knowledge about what families go through and do recognize more and more what is happening to these families. So this has led to other initiatives such as, there's workshop talking about what is PTSD there's as we're developing and implementing an approach of care delivery for our children with medical complexity, I think we're developing those kind of understanding and knowledge. So this is going to be an evolving care delivery. And I think bringing this to the forefront, as you're doing today, is really groundbreaking and making a difference.
Yeah, thank you for that, Dr. Major. And so many great examples there of the resources that you have in the CHIO program, but how those can be reproduced elsewhere. Isabel, I'm going to go to you with a question from Susan Lemoyne, and I hope you're able to answer this one and to whatever extent you feel comfortable. But Susan's asking if we'd be willing to address mental health and coping while going through, for example, the first year of your experiences, or being told that hypervigilance is a trauma response. So, what did that first year look like? And I've been that hypervigilant mom, didn't realize it was a trauma response at the time. I do now. It's feeling a bit judged as well with sometimes how I was responding. Can you just talk about that a little bit and give Susan some insight to that first year, if you can think back to those years? Long time ago, 18 years.
It's a long time ago. I'm old. I think it's a bit tricky for me because we slid into it so slowly with our son. Because we were in this zone of not being diagnosed. For us, a lot of the trauma I realized we had now was around not being believed that something was going on with him because he didn't have a diagnosis. So it's interesting because I'm only kind of realizing now that a lot of my medical avoidance has to do with the work we had to do around convincing healthcare providers to pay attention to us and to believing what we saw at home. And, we tracked everything. And because our experience was like that, and I'm sure other people had an experience like that, we kind of slid softly into this world of complexity. I don't know how open I would have been to hearing about it back then. If you contrast that to kind of my other, like when I think of kind of my, if you think of my kind of more harsh trauma responses around when our son was in the PICU, when he was a little bit older, when he was 6, and we had some very difficult time there. I think I would have been very open to hearing about the fact that I could have traumatic response around that. My behavior changed a lot, and I had a huge mental health response to that. I think had I known that I could have had a traumatic response, that I was having a traumatic response around what happened there, I would have sought help much, much earlier. Does that answer, sort of? We have a weird experience.
Yeah, it does. No, and I appreciate you sharing. And I'm just reflecting too. I'm watching the chat box because it's going crazy. Just want to flag for people. There's some great resources popping up there. So I might ask our friends from Children's Healthcare Canada to storyfy this a little bit for us and pull out some of those great comments and resources that are just flying through the chat box. There's some great stuff there. And Isabel, I really appreciate you sharing that. And it brings us to a similar question. Maybe, Jamie and Tim, you can pick up. Wendy Tavares is asking, how can clinicians ask a parent or approach them in a respectful way about how are they doing? And when they're picking up that something is going on, and more importantly, what's the best way to bring up the benefits of talking to someone? Just kind of paralleling what Isabel just shared. Do you have experiences around that or some advice to offer back to Wendy?
One of the things that Tim and I talk about a lot, we've opened up here about is, that the doctors and nurses don't have the training for that, which would be so beneficial if they did, because we've had a lot of experiences that were very dramatic, including when our son passed away and we were given the decision to make, are we calling it, is his suffering too great and you hold him and let him peacefully go, or do we keep trying and he's going to suffer greatly? Not having the support that was there and not having a social worker present or the training of the nurses and doctors. And same thing when I found out about Olivia's cracked bones and severe rickets, and her bones are translucent. And I think what's really important is communication and having support available, because of course it's my child. People have a hard time relating if they haven't had that experience. So a lot of nurses and doctors don't have a child that's in that position, but when it's you, it's you feel powerless. And I think that you know, again, I've been very fortunate that now that I am part of a program where someone comes running up and says, I'll call you later or anything, I look forward to that because I know that they're going to help me sort out that circus in my brain.
Yeah. Yeah, the circus in the brain. Isabel, you have a redirect there. You said it in the chat box, but can you add?
Yeah, I think lots of us carry a lot of guilt. When things have gone wrong, I blame myself because I've missed things. And I often feel like a failure for things that have gone wrong. And I think although I welcome help, that there are ways that I would be approached that I might feel like I'm being judged. And that approaching, if you have a good long-standing relationship with a parent or a patient, it's easier for you to do it with tenderness. But I think going with an offer of, I see you're doing a really great job, but I'd like to offer you help, feels differently than, whoa, you're really struggling and you're kind of breaking down. It feels, and even if you don't intend it that way, we hear that. We hear judgment when you don't intend judgment because we are constantly judging ourselves for our failures.
Isabel, I just want to reach across and give you the hugest hug through the screen, a COVID hug.
It's a COVID hug.
Thank you for sharing that. And there is a lot of emotion here around that fear of judgment and the shame and the guilt and the fear that is all wrapped around us. We're 2 minutes away from the end of the webinar, and we've tried to get as many questions as possible. There's a couple more in the chat box there that maybe we'll try to address offline. Paula is through the Ken link or the Ken site going to provide some of the resources and really important constructive comments that come up in the webinar chat. There's a lot there. I want to thank you all for everything that you've shared. Jamie and Tim, we've had a couple of chances to do this, and I feel like sometimes we need to have a big fat glass of wine here in Ottawa and not talk about trauma-informed care, talk about something else. And Isabel, always— I
want wine too.
Yeah, you want wine too, but you're in BC. But it's always so great to chat with you, and you're always so willing to share, and your insights are absolutely incredible over 18 years of your journey with Zach. And Dr. Major, I don't know what we can say about you. Inspirational leader in this space. Now it's going to make me emotional. Dr. Major was Kate's doctor. And everything that we've been reflecting on about what compassionate and trauma-informed care looks like, and partnering in care and truly developing a relationship to do the best thing for a child is what Natalie Major embodies. So thank you so much for being here. I'm going to put up our last slide, or Isabel's going to put up our last slide, which talks about what that embedding a trauma-informed approach to care can look like. And really, I want to leave you with 6 key principles: safety, trustworthiness, creating trust, transparency, open communication and being transparent, peer support. That's come up quite a bit in the web chat. Families helping to lead families, and institutions seem to be averse to this and not comfortable, but it is huge. And a shout out to Kim McLeod, who was my first peer support, who just basically walked into my daughter's room and offered some advice and insight, and it changed things for us. So that peer to support, collaboration and mutuality, that partnership in care, empowerment, empowering parents, but supporting them at the same time, trusting their voice, trusting their knowledge, voice, choice, cultural, historical, and gender issues, making sure that we're creating safe space for all, not just those that feel comfortable with language or education or comfortable with the hospital environment, but we're creating a safe space for all. I want to thank Children's Healthcare Canada for inviting our panel today. And again, a huge thank you to our panelists and all of you. We've got 141 participants today, and I think that speaks volumes to the importance of this topic, the value of this conversation. And I hope you're all feeling inspired moving forward in your own organizations and your practices to make some change and bring compassion into your care space. Thank you. So Paul, I'm not sure if you're doing a closing slide or not.
Oh, I was chatting away with a mute. Thank you. So thank you so much, Julie, Jamie Lee, and Tim, Isabel and Natalie, for sharing your time and expertise today and for sharing your stories, which are, it's clear they resonate with a number of folks on our panel and in the audience. We want to thank all our members and other attendees for spending this time with us today, and hope you depart with some practical knowledge or support to bring back to your home organizations, or that we can bring to your home organizations. We have a packed fall Spark Live webinar schedule coming up next week on Tuesday, September 22nd at noon. We'll be hosting Parenting in the COVID Pandemic to discuss the challenges of parenting during the pandemic, with a special emphasis on parenting the child with neurodiversity. And on Wednesday, September 23rd, in our typical webinar time slot at 11 a.m. Eastern, we are hosting Evaluating Factors That Matter for Sustainability of Large-Scale Improvement Initiatives, the case of lean in pediatric healthcare in Saskatchewan. To stay up to date on all our Spark webinars and other events and activities, please sign up for our newsletter on the Children's Healthcare Canada website, and follow us on Twitter at ChildHealthCan if you haven't already done so. And just a note that registration is now open for our annual conference taking place in November. To register, visit our Children's Healthcare Canada website and click on events. So thanks again for joining us today. Thanks to Julie and our panelists for supporting our webinar program, and hopefully we'll see many of you back here next week. Bye, everyone.